Hello, this is Peter Pittenger, and I'm going to do a little presentation of my PowerPoint slides for our final project. Okay, so the specific determinant of health that I tried to focus on for this final project was healthcare access, which would basically encompass your accessibility or your ability to get and receive quality healthcare. And I tried to focus it on low income areas. And I chose two towns in my county, Spring Valley and Haverstraw, New York, West Haverstraw, New York. They're both located in Rockland County. They would, from what I found, just some research and general knowledge of living in the area for 27 years, they are the more underserved, underprivileged, and disadvantaged communities or towns. Although I'll get more into the actual program in a second. So here we go. Name of my program is Healthcare for All. Woohoo! So I got a little picture of Bernie Sanders on there. That's my man. I love Bernie. Bernie always talks about how healthcare is a human right, which is, in my opinion, very true, and not a social right. So it is something that we should all inherently be given. So I said, program is Healthcare for All. The program looks to make healthcare services in low-income neighborhoods in Rockland County more accessible and free of charge. It looks to operate under the usage of federal grant money. We will use upstart clinics and resources that are donated from more affluent organizations or hospitals around the county and the state. Healthcare workers will operate under the assumption of it being pro bono work. If there are funds that can pay them eventually, then that would be great. If not, they can kind of use it as a tax write-off. This program is meant to last for 8 to 12 months. It would start in September after Labor Day and end the first week of May. And it would continue until regularly scheduled federal grants or funding can be provided as the agency grows. Income taxes from the county can also be allocated towards services. All right. So a purpose of the program is to provide direct care, mainly outpatient primary care, to individuals who qualify. Now, qualifications will require individuals to submit W-2 tax forms, proof of employment, and current income status. All right. Services are rendered to individuals with an income of less than $22,500 for a single user, $32,000 for married or joint users, and $40,000 for families of 4 or more. So you must earn under those in those specific categories. We're looking to address health disparities that come about through income inequality, which is why we're looking to check how much someone makes in a year to determine if they qualify for the service of this program. The major significance of this program is that the populations that we're going to focus on are African American communities, Latina communities, and Native American communities. And we're going to look at how they experience more adverse and negative health outcomes and health outlooks based on statistics from the Rockland County Department of Health. The organization looks to offer regular medical checkups, blood work, STD testing, prescription drug medications, MRI or CAT scans, other primary care services, all free of charge to those who struggle financially in Rockland County, but mainly the focus on those in Spring Valley and Haverstraw, New York. But it will be a county-wide service for anyone that applies. Stuff like premature death, so death before the age of 65, hospitalization rates, adolescent obesity rates, HIV case rates, diabetes development, cancer screenings of these populations will be targeted due to their higher prevalence in the county. And I operated under this assumption, not really an assumption, it's based on actual statistics from the Rockland County DOH, which can be found on slide 3 here. All right, moving right along. Our targeted population for our program will be low-income individuals over the age of 18. In some instances, family requests and services may be rendered on a case-by-case basis. These individuals have to fit into the aforementioned economic brackets and requirements. The community will be serving will be specifically targeted towards African American, Latino, and Native American populations. Locations of the services will be in the towns of Spring Valley and West Haverstraw to better reflect the demographics we are trying to reach and get services to. So if you do not live in those two towns, but you qualify for the services, you can still go, but they are going to be located, the clinics and program, in those two towns specifically. And our targeted populations are culturally competent as they have grown up in these communities, They've shared similar cultures, beliefs, traditions, lifestyles. They have similar socioeconomic statuses, and they work in the community with fellow members that will also qualify for these primary care services free of charge. The planning team, it will be comprised of a representative from the Rockland County Department of Health, an executive director on care and innovation, a consumer engagement coordinator, an associate research professor on medical studies, preferably from Rockland Community College, a few registered physicians and nurse practitioners, maybe from Good Samaritan Hospital and Nyack Hospital as well in the county, other clinical and medical staff members. And collaboration will occur with our pro bono and hired workers and the DOH to help coordinate which services will be required more frequently and more urgent based on countywide health statistics. So if, for example, STD testing is more prevalent and needed, then that will take the forefront. The planning team will meet twice a week, Tuesdays and Thursdays, to further discuss logistics, care needs, supply gathering, hourly schedules, information spreading to community members, insurance claims, and logistics with that. All right, moving right along, we got communication and promotion of healthcare for all. We will put flyers around town, not just Spring Valley or Haverstraw, every town, Pearl River, Nanuet, Orangeburg, Pomona, you name it, Suffern. All right, we will put pamphlets at our local health department and other local healthcare service providers such as City MD and other privatized physicians. We will have online informational resource link and website that we can get out. We will have search advertising on internet and social media apps. So, like when you're on your Instagram, we're going to try and get ourselves on that advertisement as well. It's kind of weird sometimes when that happens, but this would be for a beneficial reason. We will have video marketing via television commercials, so News 12 and all that, and online media. And of course, word of mouth, okay? That's the best way to get the ideas and the program out there is word of mouth. Moving right along, we got program launch. I said it will start on Tuesday, September 8th, 2021, and run until Sunday, May 8th, 2022. That's a total of 8 months in length for our program, and we will look to further evaluate our services and outreach to the community as well as overall effectiveness is what we're going to be looking at, all right? And we're doing this just to coincide kind of with the school year, vacations with the summer, and just get some time to get the program started. Evaluation, moving right into that, segue. This program will continuously be evaluated based on Rockland Department of Health statistics. We will look at things such as HIV positivity rates, hospitalization rates, emergency room visits, newly diagnosed cases of diabetes, new cases of various cancers, prescription medication usage and effectiveness, onset of obesity in correlation to total population, and much more. All of these statistics will be cross-referenced to our service populations in the African American, Latino, Latina, and Native American communities of Rockland County, and we will compare it to the previous data that we had prior to starting this program, because the whole point is to see, are we helping these underserved populations more specifically? And potential limitations. So just off the top of my head, there could be funding issues. It's kind of like a dream to just have a pop-up clinic and programs in a county and just offer free services like this. So funding from government, community, tax revenue, grants, things of that nature, outside donors, that could be a limitation. But in a perfect world, in a perfect scenario of doing the project, funding would not be an issue. Issues with finding employees to work pro bono. Yes, they can use it as a tax write-off for, kind of selfish reasons, but a reason nonetheless. Hopefully that people would want to volunteer and do this out of the goodness of their heart. We might have issues with finding workers or funds for the workers, insurance issues with covering costs of care, liability issues if we don't have proper waivers. Are we going to be reactive or proactive? Are we hitting these targeted populations before they experience these health adverse outcomes, or is it after? And of course, resource management as well. And lastly, the target area. When the program starts, it's important that we keep services and render services only to these targeted populations, African American, Latino, Latina, Native American. And it's important to stay within these guidelines and demographics as we are looking to collect data on our efficacy with helping these underserved populations in the Rockland County community. Overall, if at the end of the program we notice significant changes to health statuses, disease rates, or transmissions, then we can open it up open up the program to include other races or ethnicities, other people in the county, and maybe even start an expanded pediatric care for ages 10 and older. All right. So that is my program. It is called Healthcare for All. And it would be beautiful if one day in America, healthcare was not only available to everyone, but free of charge. All right. Thank you for listening. I appreciate it.